for hopeless sinners who has hurt all mankind. Just save his soul, believe one love. What about a one love? What about a let's get together and feel alright? As it was in the beginning, one love. So shall it be in the end. One heart. Alright. Give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright. One more thing. Let's get together to fight this holy Armageddon. One love. So when the man comes, there will be no doom. One song. Have pity on those whose chances grow thin. There ain't no hiding place from the Father of creation. Yeah. One love. What about the one? One love. What about the let's get together and feel alright? I'm fleeing to mankind. One love. One heart. Give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright. Give thanks and praise to the Lord, and I will feel alright. So let's gonna get together.
Good evening, ladies and gentlemen. Welcome to the Mind-Body Connection. As you know, this is a special we have today on the Mind-Body Connection on Island Zone Radio. Today we'll be talking about coronary artery disease with my friend, Dr. Indra Sinanan. So let's talk a little bit. I want to see, I see Rajiv Nandalal, he is in studio here tonight. Varshini Kedarnath, she is in studio tonight too. Anand Budram, the president of the Caribbean Voice, he's locked on. So thank you very much, guys, for tuning in. While we allow people to come on, we can probably go for another song. You guys are ready? We can play another song.
राम नाम का पक्का, राम नाम का पक्का. Put one hand on your waist and one hand over your head and get ready to chunky. Salute. हो जा राम नाम का पक्का लोभी, क्या गया में रखा. हो जा राम नाम का पक्का लोभी, क्या गया में रखा. क्या गया में रखा, क्या गया में रखा. हो जा राम नाम का पक्का लोभी, क्या गया में रखा. हो जा राम नाम का पक्का लोभी, क्या गया में रखा.
walk up your body. This is a celebration, more like a big reunion. We don't play with illusions, one happy nation. Everybody come and dance, clap together. Now we move to the tassa. Everybody come and dance, clap together. It's G.I. Big Rich and Charmer.
दुनिया दौलत मालिक जाना बनिया बैठ लड़ाई
दुनिया दौलत मालिक जाना बनिया बैठे लदाई
वो जाने माया संग गए सब यही रह हो जाए वो जा राम नाम का पक्का लोभी
क्या बया मेरा का
वो जा राम नाम का पक्का लोभी
क्या बया मेरा का
क्या बया में रखा क्या बया में रखा
ओ जा राम नाम का पक्का लोभी
क्या बया में रखा
ओ जा राम नाम का पक्का लोभी.
Well, welcome back again to the Mind Body Connection. This program is brought to you by the Caribbean Voice on Island Zone Radio. As I said, this is a special edition on the Mind Body Connection, and today we will discuss coronary artery disease with one of my good friends who we rub shoulders, work together as colleagues at North General Hospital. I'm so glad that you have decided to come sit down and talk to me on this program today because you guys and we all know how important our heart is to our body. Why I asked her to do this is because I see so much people dying of cardiac-related disease, and so I thought to myself, I said, you know what, I would like to address this somehow or the other, and I'm so glad. You know what, this was in the work for a long time between me and her, and I asked her if she can do anything to help me on this program today. So let's go and let's talk about this disease. About 610 people die of heart disease in the United States every year. And guess what? 1 in 4 persons die. Heart disease is the leading cause of death both in men and women. More than half of the death is due to heart disease. And in 2009, there were more men who died than women. Coronary heart disease is the most common type of heart disease, killing over 370,000 people annually. Every year, about 735,000 Americans have a heart attack. Of these, I said 525,000 had a first attack and 210 had a second attack. There was a survey done in 2005 and most responded, 92% recognized the chest pain, the signs and symptoms of the heart attack, and only 27% were aware of what the signs and symptoms were and went to call 911 or not. About 47 of that suddenly cardiac death occur outside of the hospital. So, you know what, we team up together so that we can know what to do when someone is experiencing chest pain. We will go through this all over. And before we do that, Dr. Indra Sinanan is with me in studio today. And I want to introduce you to her officially. I am very proud, like I said to you guys, I am very proud of her. We both work at North General Hospital for many years. But when I talk about her, I want to use the word capital woman because she's all of that. And she enjoys a balanced life. She was a registered nurse there. She worked in the medical surgical area. And then she went on to work in the ICU. And she has been flying very high in the sky because you know what? She not only completed her RN, she has a bachelor's degree in nursing, a master's in nursing, and she also went to complete her doctorate in nursing. So I'm very proud of her. And not that alone. You know what? Indra has done so much for her own self. She enjoys life and she can talk about all of this because guess what? She party a little bit. She is all the way from Trinidad and Tobago and she like her music very much so. And in fact, to be very honest, one year I was in my office sitting down watching a show on YouTube, and surprisingly, I saw her on the boat. And I said, oh my God, look at my friend there. That's my friend, you know. So I was kind of surprised to see her there. But she's everything of a woman. I'm so proud of all her accomplishment. She's also working at one of the leading hospitals here in New York, in the cardiac lab. So these accomplishment is very good. I also would like to say thank you very much to her husband, Joey Sinanan, for bringing her in studio, and he sit with her here, and I'm sure that he will enjoy this conversation between me and Dr. Sinanan. It's always good to have your friends, and it's going to be an interesting conversation because we work together. She will be very, very comfortable, as well as I'll be very comfortable in asking her all the wonderful questions and all the things that you guys would want to know if you're experiencing chest pain. And we're going to dig into this as much as we can. But I would like to say hello to some other people that we have here, a lot of viewers. I want to say thank you very much for tuning in to the Mind Body Connection. Thanks to Mr. DJFS for helping us out here, especially on this Sunday afternoon. I have Geeta Balde locked in, Mr. Anand Budram, Maharani Dubey, thank you very much for tuning in. Geeta Balde, yes, Shanti Chan, thank you very much for watching. It's very nice. Let me see who else we have here. Somnath Hiralal, thank you for tuning in. She said, good afternoon, Mr. Rampersad. Maharani Dubey, well, good to have you, my dear. I'm sure you will learn a lot of things. And I want to say a special thank you to our guys behind the music here, Rajiv Nandalal, Adit, and we have Adit's younger brother who has been DJ for us all the time. Okay, we have Elizabeth Lowe. She's locked in. Jesus Lightning. Yes. Pamela Jeffers, all the way from Pennsylvania. Maria Harris, a friend of the program. Thank you very much for tuning in. The volume, yes, I see that. I have to get accustomed to coming close to this here. And Miss Chunilal, all the way from Guyana. Thank you very much for tuning in. And my good friend, Vimala Prasad, thank you very much for tuning in this important topic we are going to talk about. What I want you guys to do is to continue share this page so that other people can watch it and they can learn something. Harry George is watching. Alvin Ramsarup. Harry George, thank you, my friend. You've always been supportive. Mamas, thank you for tuning in. Kiran, thank you for tuning in. Who else do we have here? Yes, we have Vimala. So thank you, guys. What we're going to do, we will come with another song. After this song, we will bring Dr. Indra Sinanan, and so we can have this conversation. All right? Let's go.
I could hardly believe it when I heard the news today. I had to come and get it straight from you. You said you were leaving, someone swept your heart away. From that look on your face, I see it's true. So tell me all about it, tell me about the plans you're making. Oh, tell me one thing more before I go. Tell me, how am I supposed to live without you? Now that I've been loving you so long, how am I supposed to live without you? And how am I supposed to carry on when all that I've been living for is gone? Too proud for crying, didn't come here to break down. It's just a dream of mine is coming to an end. And how can I blame you when I built my world around the hope that one day we'd be so much more than friends?
That's right, ladies and gentlemen. Here is Dr. Indra Sinanan. Thank you very much for the cheers. Thank you very much for the cheers. Yes, Mr. Lightning, your mom is in studio, but I wanted to say a few things. And I'm so glad and so proud of your mother and of you guys too, because I know you guys are doing so wonderful in life. So, Indra, we're going to talk about overview of coronary heart disease, signs and symptoms, what causes coronary artery disease, what are the risk factors, some of the complication and prevention of heart disease. So welcome aboard, and I'm so proud of you and so glad that you are with me here today, my dear. I know that you are not accustomed to all these wonderful things, but you know what? You deserve all of that and much more. Go ahead.
Thank you so much for having me here. It is really a wonderful thing to be doing, to be giving back to the community and empowering people through education, which is something I believe everyone should strive to do. I mean, this is what we do as the basis of patient care.
Right.
Patient teaching is such an important part of patient care. And again, it's empowering patients so they have the information and the proper knowledge to make decisions about their health. Because now healthcare involves the patients.
Right.
They are the center of their own care. It's no more the doctor just tells you what you should do and you just do. Now you have to be educated to be making those decisions along with your provider.
And you know, it's a good thing you and I know that you know you have your patients and that you let them know, you get them involved of the care, and it's empowering to them too, which is a good thing. And I know in your capacity that you do a lot of teaching.
Yes, yes. A lot of teaching, a lot of patients come in, and I would have to say literacy is has a huge impact on how patients manage their diseases.
Right.
Now, I'm not saying that everyone have to have a college education or anything like that. You can simply teach patients, you know, giving them straightforward information so they can understand. You adjust your teaching according to the patient's level of understanding.
And another good thing I know that you guys and we all do is that when they're discharged, upon discharge, they get a printout of their diagnosis and how to take care of them.
Yes. Yes. So at this point, I don't particularly work with inpatients. I work in outpatient cardiology. I see patients in outpatient cardiac clinic, and I also work in the cardiac cath lab.
Wow.
So I do a little bit of both. I don't work with inpatients per se to say that I'm discharging them, but after they have that coronary angiogram or cardiac catheterization, which is the same thing, they have to come back for a follow-up visit. So you
Right,
have to
right.
still continue. It's always a process of patient education and teaching.
That's right. I know that you want to say hello to some of your viewers here.
Well,
Go
yes,
right ahead.
I want to say a shout out to the Trini Posse because I see a lot of my friends are signing in and joining. Thank you so much. And also my friends and colleagues, I see one or two names in there, and my family. And Zeus Lightning, please behave. I know you're going to create trouble for me today. Kate and her family, thank you so much for lending your support and listening in. Thank you. I appreciate it.
You know, let's go. So let's talk about cardiac disease. I mean, there's so much people having coronary artery disease.
Yes.
And if you can just give us a brief outline of what is it really?
Okay. So as you say, there's a lot of cardiac issues out there. People can have coronary artery disease, also known as coronary heart disease. They can have heart failure. They can have irregular rhythms, arrhythmias of their heart. They can have different issues going on that might require them needing pacemaker or defibrillators and things like that. And those are all different cardiac topics. And like you say, we will be focusing on coronary artery disease. And for the sake of conversation, I'm just going to say heart disease, just so it's easier for us to
That's right,
say.
that's right. We got to make
So-
it easier for our
yeah.
viewers, you know?
Of course. So when you talk about heart disease, you're talking about the arteries that supply your heart with blood.
Right.
Okay? Arteries that supply your heart with blood, you have several major arteries, you have 4 of them, and then you have a lot of branches. And basically they encircle your heart, and they supply it with the blood it needs to meet the demands of your body. So when you're running up that stairs, you're walking, you're rushing, you're carrying heavy stuff and items around. All of that increases the demand on your heart. And we want to make sure that those arteries are nice and clean so they could meet those demands of your body. Okay, once you develop plaque in there, once plaque starts building up within the openings of the arteries, the lumens, if you will, once plaque starts developing in there, then there is a chance you can have a blockage in the flow of the blood that's passing through that artery.
Yes, yes. And what are some of the signs and symptoms, what we really look for?
Well, the thing with coronary artery disease or heart disease, it doesn't, your signs and symptoms in most cases occur after you've had some type of disease already progressing in those blood vessels. But before we get to that, we'll talk about the risk factors.
Okay.
So, obesity, smoking, unhealthy lifestyle in terms of diet, lack of exercise, high blood pressure, cholesterol, diabetes, all of these things.
Hypertension.
Yeah. All of these things cook together, and it's a nice, perfect recipe to build up some nice plaque and that sit there in the arteries. All of it contributes in its own way. So it's not things that people don't know about. If you smoking actually is the number one risk factor.
Really?
You would think if you have high blood pressure, you have diabetes, you have cholesterol issues, yes, those are heavy hitters, but smoking can be the worst one out of all of them.
Really? I didn't know that.
When you are smoking, it not only affects the arteries of your heart, it affects your peripheral arteries, legs, carotids, in the neck.
Right.
So people who smoke have a higher risk for developing that type of issue.
Right, right.
Usually they're the ones who not coming in complaining of chest pain. They're complaining of leg pain because they get a lot of leg pain, as if they've been heavy smokers.
Wow.
But by the time you have signs and symptoms, which is chest pain, everybody knows about chest pain.
Right.
Shortness of breath, fatigue. These are signs and symptoms. If you are developing these, then it means maybe there is something. And why I say maybe, because there are people who will come in with all the classic symptoms.
Right.
And they may not have coronary artery disease. So when you have symptoms, don't ignore it. First of all, what you should do, you establish a primary care provider and let them do that baseline testing for you. Check your blood work, your labs. Let's see what you have. Do you have diabetes? A lot of people walk around not knowing they're diabetic or borderline diabetic. Do you have high blood pressure? You may have it and walk around not knowing.
Right.
You go to your doctor, establish care, have these things checked. Once you have that checked, now you go back to your doctor and you have these signs and symptoms. They can do further testing on you to evaluate to see if it's cardiac. If it's not cardiac, is there something going on in your lungs? If it's not cardiac, it's not lungs, then they look, maybe it's your stomach, because acid reflux can cause and present itself like chest pain for a lot of people. So how do you know which one is which, right?
And that's why the best thing to do is to go and see your doctor.
Yes.
And Indra, at what age do you think that someone should really start having an annual physical? And it's so important to have these physicals so that because you and I know that these things could be silent and you would not even know that you're having any problem, going to have a heart attack. Some people have a heart attack and they don't really even know that they're going to have a heart attack.
We have patients as young as their 30s.
Really?
Yes. And what I would say is, when you are younger and you're visiting your pediatric doctor, you're going for that yearly checkup.
Right.
Why is it that when you become an adult that you don't continue? You just have to find an internist, a primary care provider, and continue your care like that. And they will determine, based on your family history and your risk factors, how often you should be coming to have certain things done. Okay? Now, I know not many people might have access to healthcare too. There are people, depending on where you are, you may not have access to just pick yourself up and go and have yourself checked out, but you should at least try and make that a priority to have it done at some point.
Wow. So what we can do now, let's send out some greetings. I heard the volume is a little low, so we're going to fix that. In the meantime, we can say hello to some of our viewers. Yes, Maharani, we are going to try fix that volume. I don't know what happened. Priya, thank you very much for tuning in to the Mind Body Connection. Rakia, all the way from Canada. Thank you for tuning in. Who we have else here? Michael Nalini Naidu. Thank you for tuning in. We have Deo Moti all the way from Florida. Thank you very much. So let's go to another song, and we'll come back and turn up this volume a little bit, okay?
Life of a vanity. Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. And when you're sleeping on the cold concrete, broke and hungry, now have no food to eat. Work on 7 days of the week, and only have one shoes on my feet. Remember, time is the master, and Jah is my provider. Real wealth is health and strength. Don't be no suicidal. Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. When all hope is lost and your back is against the wall, never giving up, no, never giving up. And when you feel like you're all alone and you're traveling the rocky road, shall we lift you up? Shall we lift you up? Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. No. Life over vanity, love for humanity. More love music, represent for every nation. Life over vanity, love your life, live your life, love your life. Life over vanity, love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. Love your life, live your life, love your life. Love your life, live your life, love your life. Not because you're broke, you're gonna hate your life. Because you're poor, you want to end your life. No.
All right, guys, welcome back to the Mind Body Connection. This program is brought to you by the Caribbean Voice on Island Zone Radio. This is a special edition on the Mind Body Connection, and today we are discussing coronary artery disease with my sidekick here, Miss Dr. Indra Seenan, and
Just call me Indra, please.
yes, she doesn't like all the fancy things, but yeah. So, Indra, let's go. I heard there were some low volume, so let's go ahead and recap a little bit of what we've said just now.
Okay, so basically what we spoke about before, and for the benefit of those who were not able to hear, I hope that you are hearing now. We were just speaking about the risk factors of coronary heart disease, and for conversation-wise, we'll just say heart disease. We spoke about what it was and what were the risk factors. And basically, heart disease is a buildup of plaque in those arteries that supply your heart with blood. And if there's a blockage in there that is obstructing the flow in one of these blood vessels, then you may develop signs and symptoms. And some of the risk factors that causes heart disease are high blood pressure or hypertension, high cholesterol, diabetes, smoking, inactive lifestyle, unhealthy eating habits, even alcohol can help contribute towards that. And studies are showing that there are other types of risk factors like sleep apnea that may contribute or increase your risk for heart disease.
That's true. What you're saying. Also, we have age, and that we can't change age, or nor do we can change anything about sex, because from what I was told is that more men, get
Right.
coronary artery disease, and more men dies of coronary artery disease. So another thing is that a lot of cholesterol problem, and as we're talking about cholesterol. Indra, a lot of times we love the fast food and we love to run and get McDonald's and the Chinese food, and it's bad for us.
Yes. So let's just go back to a bit what you said about men. So yes, men have a higher risk for heart disease like after age 45. Men will have a higher risk, but now people are just developing disease at even younger ages. But men do have a higher risk. Women become on the same level as men when they become postmenopausal. So women, we have those hormones that help protect us. But once we lose the protection of those hormones, then we are lined up right up there with the guys. So it's very important. You have to start the earlier the better. Yes, food. I mean, it's very tough to change diet. We all come from different areas of the world. We have our way of eating, our culture. I should say that Indians are the ethnic group that has the most propensity for heart disease. Okay?
Yes,
Indian people all over the world. We have the highest risk for developing heart disease. And there are some groups that are at the top of that chain. Okay? So it's very important to prevent, because prevention is really better than cure in this case.
That's true.
Yeah.
And you know what? The other thing is that it's kind of it's a gradual process from when you're young you get older. It's what you're eating. And to know that these plaques, they built up over time. Let's say that it doesn't happen within a month or 2 months. Within your lifespan, it could be 6 years, 7 years, right? What you say?
Yeah, heart disease. When you have this plaque buildup and you have inflammation in the arteries, inflammation being caused by all these risk factors that we spoke about before. If that plaque ruptures, breaks off, then what happens is your body is naturally going to go platelets, going to go towards that area to help form a clot. And in doing so, that clot can completely block that artery, resulting in a heart attack.
That's right.
So, I mean, the classic symptoms, chest pain. We know about chest pain. But like I was saying before, if you have acid reflux, that chest pain, you can feel chest pain with acid reflux. How are you going to tell which is which?
So the best thing to do is to go seek medical attention. You go and you see your doctor.
Yes.
And they will do. And as we're talking about that, when you get chest pain now, you go to the hospital. And what's some of the tests that your doctor would do? I don't know if you want to talk about that now, or you want us to come later on.
Yeah, we can just take the conversation and go with it. Just we'll flow.
Right.
Okay. So yes, I mean, when you present to your physician, these are the things you should keep in mind. If you find, and I should say, not everyone has chest pain. Okay, women typically don't feel chest pain. They have more what we call atypical symptoms.
Right.
Men will feel the classic symptoms: chest pain, radiation maybe to the shoulder, the neck, the arm, the jaw, the back. Men can have these things. Women may not necessarily have chest pain. In fact, their symptoms are seems more like acid reflux. They don't necessarily have chest pain. Sometimes some people will come in and say they have fatigue and shortness of breath. So if you are seeing that you're having these symptoms that that become worse within the past couple of weeks, and people typically know, they might ignore it until they start noticing it becoming more frequent. couple of months, couple of weeks, whatever it may be. When you come in, your doctor is going to run some testing on you. Usually they'll do an electrocardiogram, an EKG, or some people call it an ECG, which is an electrical printout of the way your heart is beating, the activity of your heart, the electrical activity of your heart. So you can look at that and tell, did this person have a heart attack in the past? Because it can show up on an EKG.
Okay.
Is this person having an active heart attack? Well, hopefully you would be in the emergency room at that point. Okay. They may do testing before you even got to that point. They can do an echocardiogram, and this looks more at structure. An echocardiogram looks at your heart muscle. Is it pumping well enough to get that blood out and throughout your body and meet the demands of your body? It looks at valves. You know, how well do you have a leak between the valves? That type of information you get from an echocardiogram. Then you have the stress test.
Right.
So you have different types of stress tests. You have the regular exercise treadmill test. You have the exercise treadmill test that's combined with medication. And then for those patients who can't do any type of exercise, there's a strict pharmacological stress test, which doesn't involve no exercising. But yes. So with all these tests, the basic thing they're looking for is to see if your heart muscle is getting enough oxygenated blood when you put some demands on it. That's what they're looking for. So they look for ischemia, which is a decrease in the oxygenation, to your tissues. So if and I always show my patients my hand, and I say, pretend this is your heart. And this is the simplest way to explain the stress test. There's a network of arteries over your heart. So when you do the stress test, they can tell which area you're not getting enough blood. And then it suggests that maybe the artery that's feeding that area is where you may have a blockage. And it's suggested. These tests are not 100% accurate.
Yes.
Okay? If you have an abnormal stress test, then your next step is a discussion with your doctor, and most likely he or she will send you in to have a cardiac angiogram, also known as a cardiac catheterization. And another test that could be done is a CT coronary angiogram. So it's a CT scan, again, using a different type of dye from the one that's used for the stress test, and it also looks at your coronary arteries. And in this instance, it can tell if you have disease in there, if you have blockages in those arteries, and it can give you percentages. Well, there's 20 to 40% here or 60% there. If it's 60% and more, your doctor is going to send you for a cardiac angiogram or a cardiac catheterization. It's just easier to say angiogram.
Right. So my question to you now is that, so the stress test and the EKG and the echo, that does not guarantee you that your vessel is clear. Am I correct?
Yes. Well, the EKG may, you could have had a heart attack and not show changes on the EKG, depending on which area, which artery was involved. You may not necessarily show a sustained change on your EKG. It may revert itself, okay? Or you can, echocardiogram is not really going to tell anything about if you've had a heart attack or not. These are diagnostic tests.
Okay.
A stress test also, diagnostic test. It will tell you what's there, but it can't, your doctor will take all that information and then determine if you need to go to the next step up, which is an angiogram. Angiogram is very, it's the most definitive test. You're actually going in and taking a look. That's
into
what
the arteries and
you're
so on.
actually going into the artery. So they usually do an angiogram either from your groin or your wrist. They go in through the artery, and they use some very long, flexible catheters, very thin. It's about the size of this pen point, very small. And they go in and they just follow the natural pathway of your artery because everything goes back towards the heart.
Yes.
So they go up. Once they get to where they need to be, they introduce some dye. It outlines all the blood vessels that supply your heart with blood. They take pictures from various angles and they look to see if you have blockages there. If there are blockages there that need to be fixed, meaning 60 to 70% blocked or more, then they can decide to fix it.
Okay. So thank you, Indra. So the only definite thing is that if to know if you have blockage is the angiogram. And what I like about the angiogram from reading is that when they go into your vessel and they find a blockage, they can right there put in a stent inside of you.
Yes.
And so what is the stent really, and what the stent really does?
Well, the stent basically goes when your doctor, now I should say that there's also a lot of criteria, that decisions, everything has to be looked at for those doctors now to determine you need to have that stent placed there. Okay? They look at the blockage, they look at the size of the vessel, they look at where it is and so on. If they decided to put one in there, a stent, they do it the same way they went in to take a look. There are special catheters or tubings that have the stent already loaded up on there. So basically what they will do, they will go in, okay, wherever you have that blockage, they will inflate a balloon to squish, if you will, the fat, the plaque, and then they will go in. After they have done that, opened up the vessel, that spot, then they go in and they deploy the stent in there. It's like a little, I don't want to say, but just to be simple, it's like a small mesh tubing, if you will. It's opened up there, then they go in and they inflate another balloon in there to open it and keep it open. Once you have a stent, it's yours for life. You don't get to get rid of it after. And keep in mind that stents can also clog. So the same things you would have had to do to keep your natural arteries open, if you get a stent, you still have to do that because your stents can clog.
And I know that there is a medication that you call Plavix, and you will also have to take that for the rest of your life, right?
Right. So when you get a stent, you do have to have this blood thinner, Plavix just being one of them. Plavix, also known as clopidogrel. There's Brilinta, there's Effient, all various blood thinners on the market. Baby aspirin is going to be something you'll take lifelong. If you have coronary artery disease, you are usually prescribed aspirin 81 milligrams, which you take ongoing. The Plavix or the other types of blood thinners, your doctor will decide what the specific length of time is that you need to keep taking them. And it depends on also what your other risk factors and how much disease burden you have with the cardiac disease.
Okay, so let's go to some music now, and we'll take a breath, and we'll continue this discussion.
Yeah, you could tell I'm sweating here.
Okay, guys, we're gonna go for some music now, and when we come back, we'll have this discussion.
Tell her try your best just to make it quick. Home attend to the sick. Cause there must be something she can do. This heart is broken in two. Tell her it's a case of emergency. There's a patient by the name of Gregory. Night nurse, only you alone can quench this thirst. My night nurse, oh gosh, oh the pain is getting worse. I don't wanna see no doctor. I need attendance from my nurse around the clock. 'cause there's no prescription for me. She's the one, the only remedy. Night nurse, only you alone can quench these thirst. My night nurse, oh, the pain is getting worse. I'm hurt by love. I don't wanna see no dog. I need attendance from my nurse around the clock. 'Cause there's no prescription for me. She's the one, the only remedy. Night nurse, only you alone can quench this your thirst. My night nurse, oh, the pain is getting worse. I'm hurt by love. And I'm sure no doctor can cure. Night nurse, night nurse. Oh gosh.
All right, guys, welcome back to the Mind Body Connection. This program is brought to you by the Caribbean Voice on Island Zone Radio. As we have said earlier, this is a special edition, and we are talking about coronary artery disease. In studio with me today is Indra Sinanan. She's a doctor and specialized in the heart. And you know, it's our songs is so appropriate. Night nurse. You know, so anyway, let's go ahead and I see Lalman Prasad from Lenora. He's in Florida. Thank you very much for tuning in. And I know that you have so much of your own follower here, so go ahead and say hello to them.
Yes, I see Zeus Lightning and Kieran Muzamali creating a little trouble on this site right now. So special shout out to both of you. And I see my sister Angie Ragu is also listening, and many other family, friends, and co-workers. Thank you so much for tuning in. Before we were speaking, and I should say, I know you mentioned it so many times, doctor. I am not a medical doctor. I do have a doctorate in nursing practice, but I do work in cardiology. So,
You're
close
still a
enough,
doctor,
yes.
Yes, and with all the wealth of experience you have in nursing, remember you work in ICU, had your
Yes,
patients,
yes.
so, and then you had medical, surgical, so you're a whole bag of experience in nursing.
Experience, yes.
Yes, let's go ahead and talk to some of our viewers here. We have Maria Harris keep kicking out the program. I don't know why, Maria, you're getting throughout to the program. You should not. You're a regular listener here. I see Shanta is from Lenora on the west coast of Demerara. Kieran, thank you very much for tuning in. Your son, is you said, he's causing some problem. Yeah, his name is
Zeus
Lightning.
yes.
Yes, so thank you for tuning in, and so glad that your mom is with me here today in studio talking about, and you know, educating our audience and our viewers. And as you know, we really need to get this grip going, and then we should start from a young age to prevent this heart disease. I see Harry George said, Ken and Indra, I was having a serious chest pain, and I went through all the tests Dr. Indra talked about. It ended up that I was
a
a
muscle,
muscle, and you know,
yes.
I think I have the same pain. So thank you for sharing that.
Well, let me just mention on based on what he said. So a lot of people do come in with that type of chest discomfort. And it turns out that it's simply muscular. They're lifting something heavy or repetitious behavior, putting too much strain on one side or the other. How do you know when this is muscular? So I advocate always for going and seeing your doctor and having this checked out, okay? Because it gives you peace of mind knowing that you went and you had this medically evaluated. However, if you are having chest pain that if you touch it, if you press on it, it hurts. It's called reproducible chest pain. If you press it, it hurts a little more. If you change your position, it either goes away or it might increase, meaning if you turn to one side, you feel it lessens more than the other side. That suggests it's more muscular, okay? If you took a deep breath in and it hurts more when you took that deep breath, that also suggests it's more muscular, okay? So those are some of the points that you can keep in mind. Again, when you go to your doctor, it's so important because they have a set of questions they'll always ask you. When did you first notice your chest pain? Okay? So try and keep these things in mind if this is something that you're dealing with right now. When did you first notice it? Is it getting worse? Is it associated with activity? What type of activity? Is it simply you walk a couple of blocks or you go up 2 flights of stairs or whatever? Or is it with increased activity when you really strain yourself, you're running to the bus or so on? All of these things, they'll ask you these things to get a good idea. How long does it last? Did you take anything to help relieve it? These are some of the questions they'll ask.
Okay, I see Neela Pawaro is on. She's from the Caribbean Voice. Elizabeth Lowe, thank you. She says great information on the heart. Our good friend of the program, Priya Prasad, thank you very much. She's all the way in Guyana. I see Lee Nye is on the program. She's in Florida too. So I'm so glad to have you guys here locked on because you know what, this is a serious discussion.
I see Lee Nye also mentioned stress. Stress is definitely a huge contributor to chest pain. A lot of people can have chest pain with emotional stress, okay, when they get anxious or, they having a hard time dealing with whatever that's going on in their life. So stress is another one of those risk factors you should try and manage in a positive way.
I see Juan Nieves in Puerto Rico. So thank you very much for tuning in. Anjani Deusaran, thank you for tuning in. Bibi Ahmad, all the way in Guyana. She's representing the Caribbean Voice in Guyana. Marlon Jaikaran, she is in Guyana. Thank you for tuning in. Kieran again locked in. He's busy, so that's good. Rajiv Nanalal, he's helping out with the music and the volume and all these things. I said Lalman Prasad is on. Indrani Judistry, you're on. Thank you very much. So I'm glad that you guys locked in and do share this program. You know what, because we see the need is there. So much people are dying of heart disease, and there is things that you can really do. We also talk about, you and I were talking just now while the music was playing, and the importance of exercise.
Yes.
What's your take?
Yes, definitely. A sedentary lifestyle is certainly not going to help you. Whether it's heart disease, it doesn't help in, you should maintain a healthy weight. We all should. Even with diabetes, high blood pressure, all of these things. So I always tell people there is no magic formula. Everybody knows what it is. If you have high blood pressure, you should control your blood pressure. I mean normal parameters, less than 130/70. We tend to be a little more lenient in blood pressure as patients get older because some elderly patients can't walk around with a blood pressure that looks perfect on paper, like 120/70, because they may develop lightheadedness, dizziness, fall, break something, and then you have more problems. So blood pressure control. Cholesterol. Your total cholesterol should be less than 200 in general. Your LDLs, which is your bad cholesterol, that should be less than 100. Your good cholesterol, or HDL, and the one way to remember that is your healthy cholesterol because it has the H in it. That should be more than 30. Some labs use 30 as the bottom number.
Baseline, yeah.
And the higher your HDL or your good cholesterol, the better it is for you. And your triglycerides should be less than 150. Okay? So that comes back again to diet. You know, you avoid saturated fats, avoid trans fats, you know, avoid too much sugar, too much salt, and you move around as best as you can. Your exercise doesn't mean you have to go and join a gym and spend that money if you're not able to afford that. You walk an extra block or two if you can. You know, you try to build it into your day. You take the steps, things like that. If you're getting chest pain and shortness of breath with the steps, well then you need to go and get it evaluated.
Exactly. So and it's so important to go and do these things. And what about medication when your doctor order medication for you? Like, let's say that you feel good and you feel in your mind that your cholesterol is good, or you're hypertensive and you know, well, you should continue to take the medication and that. Again, guys, I am just being your devil's advocate here today.
Listen, that is a pet peeve for me, because I feel like a lot of people think that when they take the medication after 6 months, everything looks all good on paper and so on, and then they stop taking their medication. And you shouldn't do that. These medications are meant to control. They don't cure. Okay? A lot of patients, my own patients that I deal with, may stop taking their cholesterol medicine because their cholesterol isn't high anymore.
Right.
Yes, because you're taking the medication. Okay, and 6 months after, it'll probably start trending right back up. So it's important for you to be compliant with the medicine. Take your medicine as directed.
And when she said compliant, what it means, make sure you take your medication as ordered by the doctor.
If you develop side effects or you feel you cannot tolerate the medicines that's being given to you, then you must inform your provider. Do not just stop taking medicines and go on. People love to do that. Don't do that.
Especially some of us from the Caribbean, you know, we think that...
we are the worst.
I know they would say, you know what, I'm feeling better, I'm not going to take it. Or I'm not getting a headache, so I'm not going to take the medication.
Yes.
They wait until something really happens, and then they really go and take the medication, you know.
Yes.
So guys, we're encouraging you to, you know, when you go to the doctor, you always, if they order medication, go ahead and take your medication as prescribed. And as you said, Indra, if your doctor orders a medication and doesn't, it gives you any reaction, always call your doctor and let them know what's going on. So they could probably, they would change your medication or revise. What would they do?
They probably would. If there's something you're getting side effects from and you can't tolerate, then we know you're not going to take that medicine. So they should work with you to get something that works for you. This is a partnership. You and your provider should have a partnership, someone you trust, and they should be having that genuine interest in what works best for you and spend that time, you know, finding that out with you, with the patient.
And it's good, and it's always good when you have, like you said, your partnership with your doctor. It's always good to work with your doctor. And to be, and another thing is that you always good to be honest with your doctor. You let them know exactly what's going on. Don't hide.
Yes.
Or you know, another thing that you stop taking your meds, but 2 days before you go to your doctor, then you will start taking medication.
Yes.
You know, and these things really do happen. And you and I know that people do these kind of things.
People do. And let me just say about blood pressure medicines. When you don't take those as directed and you stop and go and you monitor blood pressure and take it today and none for next 2 days, that you're doing even more harm to yourself. Because over time your blood pressure will go higher and become more difficult to manage because you have been playing with medications on your own back and forth. Okay? Diabetes, that's a huge thing. That must be well controlled. Exercise plays into diabetes, controlling diabetes. You know, you use the muscles, it uses up the sugar and helps with control. And diabetes is a huge, you know, it plays a lot into coronary artery disease. A lot of people are diabetic, have heart disease, you know.
Wow.
Yeah.
And then I was reading something about clusters, and if you want to enlighten our viewers, clusters, like where they have diabetes, they have hypertension.
Right. So the triad for heart disease, or the clusters, you would say, is diabetes, uncontrolled cholesterol or elevated cholesterol, and high blood pressure. That's the triad. Okay? And so on top of that, if you don't control those three things well enough, you can increase your risk for heart disease. That's all heart disease needs to start cooking. And then if you throw in inactivity, unhealthy diet, and smoking on top of that,
That's the key
then
right
you increase it even more. Okay. You increase that risk.
So a couple of things, and let's, I just want to make sure that everybody gets what we are saying. Diet have a very important part to play in coronary artery disease. Also, diet, we have exercise.
Yes.
Right. So, especially, and if you're smoking, we encourage you not to smoke, to stop smoking. And of course, and you know that there is so many medication out there to help you from curbing smoking, right?
Yes, there's medication as well as there's the nicotine gum and patch, and these are FDA approved.
Yes.
Okay, you have the gum and the patch, the lozenges. You work with your provider to find out what works well for you, because not everyone can take the patch. They don't like it. It causes itching, or they forget about it. Some people don't like the gum. Some people can't tolerate the lozenges, but studies have shown a combination of patch and gum or lozenges works well.
And you could get that free too if you call 311,
Yes.
especially if you're here in New York.
Yeah,
too.
and now I believe Medicare is paying for that. Medicare,
Right,
Medicaid,
yes. Yes.
they've increased coverage for that. Now, some people are prescribed Wellbutrin. This is a drug they use for
I know that.
smoking.
Yes.
Yeah,
And it's a
then
psych
there's
medication they
yes, it helps with depression. Wellbutrin, and there's Chantix.
Yes,
What a lot
I
of
know.
people seem to be a little afraid of Chantix because of the side effects of suicide and
Yes,
all
yes,
of that.
yes.
Suicidal ideation and.
But the good thing that happens, guys, is that when you take in all these things, you have a doctor that's monitoring you. And if you're feeling any suicidal, you're having any thoughts or anything, always notify your doctor. And I'm sure that they are going to be willing enough to change your medication and give you something else, Let's go say hello to some of our viewers, and when we finish, we'll get some music, and then we'll come back again. And I'm going to read, I see Maureen Ramcharan, thank you for tuning in. I see about Kieran again is on. Katie, it is true that some doctors are reluctant to bring up the issue of weight loss with their patients. How can patients advocate for themselves, get to the care and support they need to lose weight and prevent any issues? And Kate, I like to talk about myself too. When I was diagnosed with diabetes, I start walking at least I should be walking 5 days, but because of my schedule, but I try to watch what I eat. I don't drink soda like I used to drink a Pepsi every day. I stopped drinking that Pepsi every day. I used to tell people that if you see me drop dead, please come throw some Pepsi in my mouth.
Yes,
I'm
it's
going to
for
get
Pepsi.
up and jump. But guess what? That's not going to happen. We all know. And I was so surprised that I stopped drinking soda, and I didn't miss anything. I now drink some water. I drink water, and I'll drink some tea or some coffee, but I don't even add no sugar. Sometimes I put a little honey inside to
Right.
make it a little better. You know what I'm saying?
Right, right.
So we have to take this by the horn and fight and see how best we can, especially if we want to live a healthy life.
Yes,
You
yes.
know what I mean?
And all patients, especially if they have underlying diabetes and all of that, there's nothing wrong with you requesting a nutritional consult.
Right,
In
right.
response to Kate Manino's question. Okay?
Yes,
There's
yes.
nothing wrong with asking for a nutritional consult, and they're supposed to schedule one for you or refer you to a nutritionist.
Exactly. So
Yeah.
Dr. Tan always tells me, you need to go see a
Yeah.
nutritionist. And,
Yes, even if you think you know what the do's and don'ts are, you may get some more insight from a nutritionist.
Yes, I see my neighbor Debbie Roberts. She's tuning in. Thank you very much, Geeta. I see Geeta Rampasad was on not too long ago to Raymond Hamid, all the way from Virginia. Thank you for tuning in. Thanks for sharing, loving, and soaking it all in. Yes, you are a young girl, and I tell you, if you start all these things now and listening to us, and you guess what's going to happen? You will have a long, healthy life, and it's a good thing. So let's see if there's anybody else. Harris, thank you for tuning in, guys. I'm so glad that you guys are here. John, say yes. Harry, I'm glad you're locked in. So let's go for some music now, and when we come back, we'll continue the discussion of coronary artery disease with Indra Sinanan. All right?
Can't ball in a life, man. Go on with it, go on with it. worst. Yeah, blessings we are reap and we coursing on full. Oh, we not rise and boast. Yeah, we give thanks like we need it the most. We have to give thanks like we really supposed to be thankful. Blessings all for my life and my thank God for the journey, the earnings are just for the plus. Yeah, and gratitude is a must. Yeah, me see blessings fall by my right hand. But I toast with the friends we take off every load. One time did sit down in a class and we bored. Then only said the road and me go on with the road. Third form, me say me try a thing. And you know it formed up to be a fire thing. Now up on stage with chronic say I sing. Yeah, see me all diggy soon get the higher ring. Like hello brother, me say I had to shot ya. Saw your poster, spectacular photo. Keep it burning, yes that's the motto. If me the butter pass through your shot to can't ball in a life man. Me have to thank God for the journey, the earnings are just for the plus. Yeah, and gratitude is a must. Yeah, me see blessings fall by my right hand. But I toast to the friends we take off every load. One time they sit down in a class and we bored. Then only said the road and we go on with it, go on with it. Just show our blessings upon me and send me to tell them my story. Just show our blessings upon me, and that's how I made to give him the glory. I'm delighted. Jah knows my passion ignited. Got the music get me excited. Coming like a potion. Blessings all for my life and my thank God for the journey. The earnings are just for the plus. Yeah, and gratitude is a must. Yeah, me see blessings fall by my right hand. But I toast with the friends we take off every load. One time did sit down in a class and we bored. Then only said the road and me go on with the road. Toast, yeah, yeah. Toast. Oh, we not rise and boast. Yeah, we give thanks. We have to give thanks like we really
Welcome back to the Mind Body Connection. This program is brought to you by the Caribbean Voice on Island Zone Radio. As I said earlier, this is a special edition on the Mind Body Connection, and today we are discussing coronary artery disease with Dr. Indra Sinanan, who is very versed, a nurse who has a wealth of experience in this field. So I want to say thank you very much again for coming on to this program to share your knowledge. I know both of us share the same sentiment that we want to educate our public, we want to educate
Yes.
our family, friends, and all those who we've crossed paths with.
Yes, yes. Education is foremost for everyone at every level. Empowerment happens
right.
through education.
That's right. And the more you empower this, the more knowledge you have, actually, it's better for you. So I know we talk about a lot of things, and I prepare some questions for her. Thinking on the layman, how we think about, and I'm saying, can we prevent coronary artery disease, or can we actually delay the process?
Well, we can. If you already have a diagnosis of coronary artery disease, let's say you went and you had all this testing done at some point, and your doctor says you have non-obstructive coronary artery disease. Okay, it means yes, you have plaque buildup there, but it's not obstructing the blood flow. So you have to prevent it from getting any worse.
Right.
And patients always ask that, saying, well, how do I do that? Again, we get back down to if you have risk factors, high blood pressure, you control it. Diabetes, cholesterol, you control. Quit smoking, active lifestyle, healthier eating. It all boils back down to the nuts and bolts. There's no fancy nothing. There's nothing you can take that's going to miraculously dissolve that plaque in your artery. If we could do that, then you wouldn't have people getting heart attacks. You wouldn't have people needing stents. Then we could just give them a pill and say, here, take this, and, it'll
would be
dissolve.
nice. That would
it
be
would be
nice.
nice. So until you and I find out what that is,
Yeah. And when we talk, guys, when we're talking about plaques, we're talking about fat and so on, right?
fatty, cholesterol buildup. Okay. Sometimes, and then, as we get older, age you had mentioned before, we get hardening and stiffening of the arteries as well. So all of this contributes,
Absolutely, absolutely. You're correct. And then, as you said, what can we do to prevent it? As we said earlier just now, And we were talking about if you have a strong cardiac history, what should you really be doing?
Well, strong cardiac history. Now, what is meant by strong cardiac history? Positive family history of early coronary artery disease. So usually when we ask that question, we're looking to see if you have an immediate family member, meaning your parents, your brothers, your sisters. Did anyone have any type of coronary event or develop heart disease at a younger age? Men, 55 and younger, women 65 and younger. So if out of your parents, anyone, or your brothers and sisters, anyone fell into that range, you would be considered at a higher risk.
Okay.
And so you should have your testing done, at more earlier age, keeping an eye on that. You understand? I have had patients, I have brothers, one in his 30s, who end up getting multiple stents in his coronary arteries because their father was positive. They had a positive family history because of the father. So the brother comes in just to check himself out, and he has to have stents too. Not that he was symptomatic. He came to get himself evaluated. And I should say that not all the time you'll be symptomatic.
It's good when you're when you're having symptoms, so that you know what to do. But if that's silent there and it's nothing happening, you don't know. And guess what? You drop dead.
Yes,
that's about it.
Yes, there are many people who may not have symptoms, or when they do have symptoms, like you say, it's things are really.
And that's when I say what they didn't have a second chance in life to correct all that's happened. You know what I'm saying? So.
But if you have multiple risk factors like the ones we spoke about before, you can still go and speak with your provider to have some type of evaluation. Because of your multiple risk factors, you can still get tested because of multiple risk factors.
Yes, and you can't go wrong. What age do you think it's appropriate to go and start with all of this, like your physical?
You should start getting your yearly physicals, and like I say, we're speaking about here in America.
Right,
I mean, you've been going to a pediatrician all along. Then you start going to an internist or primary care provider in your 20s, and they will determine when you need to come. I mean, in your 20s, you may not have to go every year, because younger, 18 and below, and so they have to go yearly because school requires, forms to be filled out on a yearly basis.
Right.
And your physician will determine that with you, depending on what's going on. Maybe you need to come every 2 or 3 years, or maybe you need to come every year. It depends. Everybody is different, and it has to be tailored to that patient,
No, go ahead.
No, I was just saying, it's not a one-size-fits-all. It really isn't.
Right, we are all individual. And let's say that you go to your doctor and he've done an echo, he have done an EKG, he have done a stress test. He have confirmed that there is no fat among, like around your neck area, your chest area. What do you do next when your cardiologist confirmed to you that, you don't, he didn't see any fat in there, he didn't see anything, and you're still having the chest pain? What is your next move?
Well, if you're still having symptoms and your cardiac testing is negative or normal, then we have to look at what other cause, and the most likely culprit, like I say, they look to lungs. If you're having maybe not chest pain but more shortness of breath and fatigue, they look to see if there's underlying lung issues. If both of those things are ruled out, they also look at the stomach. I mean, they may just look at the stomach if they think you don't have any issues with the lung. Heartburn is a whole other issue.
Yes,
and
it's terrible.
That presents itself in so many different ways. I mean, we know classic signs and symptoms from what we can read in any textbook.
Right.
Okay? Heartburn, people think they're going to have this burning from, the stomach area going up. They feel it in their throat. I have had people come in with shortness of breath, a cough in the morning, a sore throat every now and then. No, none of that burning. And we work them up, nothing is going on. You send them to the GI doctor, the gastroenterologist, to evaluate. They get a little something for their heartburn, and they fine as ever.
Right, that's good.
So it's very important, again, like I say, going and having that workup done.
And for the experience, especially in our Guyanese community, I hear a lot of people saying, "Oh, their stomach was hurting them, and they dead." So a lot of times I said, "Wow, what do we do when someone comes and say, no, my stomach is hurting? What's your advice?" And you and I know that your stomach is different from your chest area,
Right.
so are they really confusing this whole thing? And what do you think is going on?
Well, I feel like stomach, when you say a stomach is hurting, and this is again Guyana, Trinidad, islands, people are very vague in how they describe. They can be very vague in describing their symptoms, but they'll tell you they have a cough, what that is. I mean, that could be anything. Same with stomach. Where in your stomach is hurting you? When do you get the pain? Before eating? After eating? Okay? Are you nauseous? Are you moving your bowels? Is your stomach distended? Is it hard like a board? Is it soft? Can I hear bowel sounds in there? You have to physically assess the patient before you can come to any type of diagnosis. You assess the patient physically by doing a physical examination and doing testing, whether you're in the hospital somewhere else.
I see RW Home Improvement is watching. Thank you very much for tuning in, my brother. We are talking about coronary artery disease with Dr. Indra Sinanan here, and we are so glad that she is in studio with me today. I said, Bibi said, thank you, doctor, for taking the time and sharing all these important information on the career and the mind-body connection for all of us. And yes, it is so important. And you guys don't know, but I really wanted to do this a long, long time ago. I'm so glad that she agreed to do this. And I hope that we treat her so nice, guys, that she come back again and we can talk about high blood pressure, we can talk about aneurysm, so much more we can talk. And I hope that I don't bore her too much, so that we'll let her come back anytime on this program. I see Angela Ramsaran, she is locked in Indira Rambarose. Thank you so much for sharing. She said she's learning a lot, and that's what our plan is, that you guys learn. And Debbie, my neighbor on my left, she says, great topic, guys. My dad just had a heart attack last week. He had 3 of his artery blocked. He got 3 stents, and since then he had the procedure done. He has been struggling with low blood pressure. I heard that happen sometime too, right?
Yes, because sometimes you have a heart attack, it damages the muscles of the heart, and that's part of the recovery process, and then when you have these issues, they're going to give you medication to help your heart work more efficiently.
Right.
And in doing so, the medications, it can probably be too much medications on his system. We're not sure yet. It could be just he needs to get through that recovery of getting his heart back stronger, So that phase is very important as he works with his physician to, bring him back to that better place.
That's right, yes. And we have Angela. Angela Ramsaran is always funny, but I'm glad she's keeping it quiet on this program. She's a hot mess. I see Gita Balde, who says eat a lot of provision. Actually, Gita Balde is from Trinidad too.
Okay.
So Gita, I have your Miss Trinidad here with me. The other thing, and then, people say that eat provision, but people don't realize sometimes that when you eat a lot of, let's say, that's right, exactly. So cassava is, if you're diabetic, you can't eat all that provision that you want to eat.
Yeah, but you and I know when you make that curry dog, that cassava is the best thing to go with it. However, that is just a side note.
Yes. And the other thing is that a lot of times we can eat things but little by portion control.
Yes.
Let's talk about portion
control.
It's flow, yes.
And so we are used to eating, your parents would put, they put that plate and tell you make sure and eat every bite on it.
Right.
And you have to.
Yes.
And so we grow up just not measuring anything, but just eating until we are full. And that's why diet is so difficult when you have to change things to manage whatever your medical conditions are.
Yes, exactly. So, Maureen, I see you said I use whole wheat flour, which is an excellent thing. And later on down the program, I'm going to talk about the roti and the white flour and the white rice, how it's no good. So the thing is, when do you really go and call 911?
Okay. If you have chest pain, that is crushing chest pain, meaning you feel like something is pressing on your chest. You can't breathe. You feel like you can't get your breath in and out of you. Lasting for more than 5 minutes. It might even have to be 5 minutes.
Right.
You will know if
will know?
something is happening that's totally out of the norm, totally unlike whatever chest pain you may have felt in the past. If you feel that you are having a heart attack, you call 911. Do not drive yourself to the emergency room. Don't let your brother come and pick you up or your husband carry you. No, just call 911. If you think you are having a heart attack, you call 911.
Sometimes people worry that they're going to get that emergency bill for like $500.
Well, you could avoid a $500 bill and then have your family pay $5,000 for a funeral and all of that, I
Right.
mean, how are you to know?
Exactly. So we are saying the right thing to do is to call 911 and don't drive yourself to the hospital because
no.
on your way there, a lot of things could
Traffic.
go wrong.
You think anybody is going to move out of the street for you?
And then the other
You know?
the other thing is to while you're going there, you can get a heart attack, and then
Yes.
And so I'm so glad we're having this discussion because as we're talking about time driving, from what I know, every second counts.
Yes.
If you get chest pain, right? So if you want to talk about a little about that, just briefly.
Well, let's just say you were having active heart attack. There are time limits, okay, as dictated by the state, that when you hit that emergency room, okay, you should get, once they do your workup very quickly, because chest pain always takes priority
Right.
in an emergency room. Once you get in there and they say to themselves that you are having a heart attack, you should be up in that cath lab immediately. You surpass, go. Yeah, you don't collect no $200 or whatever.
Right,
you
right.
just go straight in
To the
and
cath
you
lab.
and you go instantly into that room.
Wow.
And they'll take a look and open up what needs to be opened up if you're having an active heart attack.
And that's the good thing, that, especially if you're living in the United States and probably some other different countries, that you can get priority care, especially because every second counts, especially if you're having a stroke or you're having chest pain.
Stroke
It's
is
really
another big thing too. Yeah. Time is of essence. Time is brain when they talk about stroke.
Exactly. So yes. And why? And we were going to say it's important to go and get immediate treatment because, as you said, if you don't get a treatment, your brain tissue, your heart muscles, all of that could damage, and so it's going to cost a longer time for you, longer time for your recovery.
Yes.
Which is going to take a longer time. So that's one of the reasons why it's so important to get, if you're experiencing any chest pain, you call 911 same time. And the other reason why it's important to call 911, I'll let you talk more about it, rather than if you're in your car and you're having a heart attack, and rather than you're in an emergency vehicle, you will get all the care, and you can talk more about it.
Well, I can't tell you what happens in the vehicle, but I can tell you if you are being carried by ambulance and your symptoms deteriorate, you become worse, they do have what they need, to take care of you, medication-wise, and all of that. They do the EKG right in there in the van.
Right.
They're looking, they're seeing, they're
see.
communicating with the nearest hospital.
Oh, they
which
are?
they will,
Oh,
they will
okay.
communicate and let
Let
them
them
know
know
they're
to
bringing
expect
an
you.
active.
Really?
Yeah.
Oh, wow.
So they're ready. The goal is to get you through there quickly. Now, chest pain, while we were saying that, doesn't always have to be, and I'm not talking about when you're having a heart attack. I'm talking about the chest pain that you may start developing, off and on, here and there, that you don't really pay attention to until it starts becoming worse, or you noticing it more frequently, or it's happening and lasting longer than it did before, or you find that instead of being able to walk 5 blocks, you can walk 2 blocks because you're getting short of breath and you're getting tired at your normal pace, right?
Yes.
But sometimes you'll ask patient about their chest pain and they'll say, well, if I took my time. But no, I want to know at what point you're starting to take your time. Where do you feel you have to cut back? And you could have chest tightness, chest pressure, chest heaviness, burning. Chest pain presents itself in all different kinds of ways. It's not just that heavy crushing chest pain that you would expect.
Like someone on your standing in your chest, I heard. That's
Yeah,
how you
for the
feel.
people who are having those type of typical, we call those typical symptoms, you know. But like I said, women, they don't necessarily have that type of chest pain. Their symptoms present more like heartburn. You know.
Do you recommend, from your experience, what about if you have these kind of problem, if you always have an aspirin close by your
Well,
bed?
if you already have baby aspirin, the 81 milligram dose, and you feel that you are having a heart attack or you have some reason to believe this is going on, you can take 4 of those.
4?
4 is just 1 regular aspirin.
Okay.
Yeah.
Yes.
Just over 1 regular
Take 4
aspirin. You
aspirin.
can take 4 babies
One
until
ti-
you get yourself to where you need to go. Yeah,
The-
chew them up. We're talking the chewable aspirin.
Right.
Yeah.
My next question to you is that because aspirin causes bleeding sometimes,
Yes.
it could cause you to bleed. Should I worry, or should anyone have to worry when they go to the cath lab? Let's say that they have to go and do a angiogram. Would they have to be worried that they're going to continue bleeding, or they have the injection?
No. When you go for a cardiac angiogram, you will get 2 baby aspirins as part of the regular protocol.
Right.
They'll give you 2. Because you're going to have these little catheters and so on in your blood vessels. So we don't want any platelets coming and sticking and creating trouble. We need to keep that blood smooth as ever, flowing, just flowing.
Yes.
So, like I said, 4 baby aspirin is really 1 regular aspirin. And I know that sometimes people say the aspirin upsets them. Well, take it on a full stomach. I'm talking if you had taken it generally. Or you could take enteric coated aspirin if you had to take it. If it causes some type of bleeding issues for you, obviously you let your doctor know, let him evaluate you, and if you can't, you just cannot take it. Not everyone can.
That's right. And
But baby aspirin is normally given to you before you have the angiogram. And if you, during the procedure, they decide that they're going to put a stent in, they give you IV medication to help keep that blood thin. And more medication in the room.
Really?
Yeah, there's a whole protocol to follow before, during, after, once you go in for procedure.
Yes, and I see Anand Budram said the critical point, guys, is to get all your checkups on a regular basis as soon as regular as possible, and so you don't wait until the horse run out of the stable to then try to do things. I see Lalita Deoprasad tuning. Thank you very much. Let's see who else is here. In the meantime, our DJ is going to get a song ready for us. Let me see. Angela Ramsaran, thank you, my dear, again. Chris V. Sin, I carry a few with me on my keychain. Oh, that's a good thing. It's a good thing to do.
I know Chris V. Sin.
You want to say?
Hello,
Shirley,
Chris V. Sin.
Shirley Bagenot, thank you for tuning in. And please do continue on a regular basis to watch this program. Go ahead.
नमस्कार आदाब ये है ऑल इंडिया रेडियो का अमृतसर स्टेशन और आज फरमाइश आई है बॉर्डर पास से हमारे दोस्त शम्स आलम की जिनकी बेगम साहिबा उनसे नाराज बैठी हैं तो ये खूबसूरत सा मीठा सा तोहफा हमारी तरफ से आपके लिए
कच्ची डोरियों 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 से मैनू तू बांध ले पक्की यारियों 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 में होंदे ना फासले ए नाराजगी कागजी सारी तेरी मेरे सोहणिया सुन ले मेरी दिल दियां गल्लां करांगे नाल नाल बैठ के अख नाले अख नू मिला के दिल दियां गल्लां करांगे रोज रोज बैठ के सच्चियां मुहब्बतां निभा के सताए मैनू क्यों दिखाए मैनू क्यों एवें झूठी मूठी रुस के रुसा के दिल दियां गल्लां करांगे नाल नाल बैठ के अख नाल अख नू मिला के ਤੈਨੂੰ ਲੱਤਾਂ ਤੋਂ ਛੁਪਾ ਕੇ ਰੱਖਾਂ ਅੱਖਾਂ ਤੇ ਸਜਾ ਕੇ ਤੂੰ ਹੈ ਮੇਰੀ ਵਫਾ ਰੱਖ ਆਪਣਾ ਬਣਾ ਕੇ ਮੈਂ ਤੇਰੇ ਲਈ ਆ ਯਾਰਾ ਨਾ ਪਾਵੀਂ ਕਦੇ ਦੂਰੀਆਂ ਮੈਂ ਜੀਣਾ ਹੈ ਤੇਰਾ मैं जीना है तेरा तू जीना है मेरा दस लेना की नखरा दिखा के दिल दियां गल्लां करांगे नाल नाल बैठ के अख नाल अख नू मिला के दिल दियां गल्लां
Well, guys, welcome back to the Mind Body Connection. This is your host, Ken Rampersad, with Dr. Indra Sinanan. Today we are talking about coronary artery disease. And as you know, this is a special edition because, we see so many times and times again, and I'm sure that you see so much people with this problem that they complain of chest pain. And I know that you and I, we're not going to call their name, but we had a colleague at our general hospital who was driving to work and he died with a massive heart attack. You know what I'm saying? So with these things, and although he was a healthcare worker, so we have to be very careful. Let's see, we have Geeta Balde want to know which part of Trinidad are you from?
I'm a San Fernando girl, Gita Baldeo. I originally was from Pointe-a-Pierre, and then I met my wonderful husband who is from Vistabella, and then we lived in Pleasantville.
Yes, and you know what? She is very lucky, though. I mean, Indra is very lucky to have a husband as his because they all one time you see them in Trinidad, the next thing you see them on Eastern Parkway.
You're giving away all my secrets.
but the good thing that what I admire about you, though, Indra, is that you live a balanced life. You enjoy. You one time we had a conversation, and I don't even remember. You said you work hard, but you also play hard.
Yes, with that stress management that we speak about, I try to balance that as much as I can. And that means leaving New York in the winter time and going to Trinidad where it's nice and hot, because I am not one of those people who can stay inside and only see darkness. That doesn't work for me.
I know. So we have a question from Maharani Dubey, says Dr. Indra. I have a question. Please, if you can answer what triggers to someone getting a stroke. What are the symptoms to expect? If you can really, she will appreciate it if you tell her what really causes a stroke.
Well, there are different types of stroke, and again, this is not my area of expertise, but based on general knowledge, there's different types of stroke. You can have what's called an ischemic stroke, and you can have a thrombotic stroke. So one, ischemic means blockage. It pertains to blockage. So maybe there's some type of blockage in one of those blood vessels in the brain area, and there's a lack of blood supply, similar to the heart disease. There's blockage, a lack of blood supply, tissue is going to start dying, and that's when you get the resulting effect. Okay, the thrombotic stroke also, again, clots can develop and form and suddenly block up a blood vessel in your head and result in, again, that clot will block and cause symptoms to you, just like the ischemic stroke. Okay, then you can have an aneurysm of the brain, where you have weakening in the walls of the blood vessels that's in your brain, and one of them could pop. burst, and then you have that blood invading that space. You know?
Also, if you're hypertensive,
Well, yeah, you have to control blood pressure. Especially there are people who have history of aneurysms in the aorta. This is a whole different other type of thing, but there are people who have aneurysms, which is a weakening in the blood vessel wall, basically, but you have to definitely keep that blood pressure under control because it can pop. If your blood pressure is too high, it can pop that and cause, it to burst, basically, and blood is spilling out.
and that's why if you are hypertensive, you need to take your medication in order to help control your blood pressure. Also, as we talked before earlier, you should really watch your diet to what you're eating. It's very, very important.
Yes.
Also, when you have these things like diabetes and hypertension and so on, importance of walking, right?
Importance of exercise. If you can tolerate exercise, you start gradually and you work up. Working out 3 to 5 times a week if you can. I know it's tough with schedules, there's work and home and everything in between, but that you have to make that time for yourself. It's difficult, I know.
Who you telling? You
Yeah.
and I mean,
Yeah, I know. So if it means sometimes I can get off a stop before my stop on
Oh,
the
you
train
do?
and walk that little, during the warmer weather I would do that.
Oh, that's nice. That's a
That's
good thing.
some of the little twinges like I would use if I'm going up to 2 floors up, I'll take the stairs, I would like to get into a regular nice routine with somebody, telling me how to do the, like a trainer or whatever.
Yes,
But
yes.
yeah,
We gotta get Joey to get you to do exercise. You all do it together.
Joy is the laziest person to exercise. I'm
Well-
saying that on air right now.
Anyway, so Maharani, that's I hope she answered your question. Juanita Khan, thank you very much for tuning in. Always good to have you guys locked into the Mind Body Connection. Harry George, he says beautiful song. So my
Thanks.
next question to you is, if someone goes to the emergency room or going to the cath lab and the doctor, they cannot do put in a stent in you, what else could be done?
Well, sometimes people do come in for angiogram and they have so much disease in their arteries that, it's not, stenting is not the best solution for them. And in that case, if that means that there's blockages or disease in more than one artery, you understand, and maybe some of the branches. So most of the times these people will need to have bypass surgery, coronary artery bypass graft surgery, cabbage,
Yeah, I know
So
that.
they will be referred now to surgery, cardiothoracic surgery, to have them, do that.
Yes, yes.
Yeah.
And so, it's always encouraging for us to do what's right for us. And the younger we start with this, and I'm so sorry that I didn't start all of these years earlier to start preventing all these things from happening. I see we have 15 minutes more to go. I told you.
Well,
that-
there's 2 questions that I saw
Go
here,
ahead.
and one of them is referring to acid reflux. And this is from, and I'm not sure where I saw it, but someone had a question if you have, it's from,
Angela?
maybe Angela.
But Angela wants to know if you like curry.
I know I was going to address that last, and yes, I do like curry. Yes, I cook curry, and yes, I like lots of pepper in my curry. yes, and yes. So, but I only cook it once a week.
Oh, okay.
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 Because, I'm trying to be moderate. Anyway, and there was a question about the, if you have acid reflux, what you should do. Well, there's a lot of people, you can take over-the-counter medication. There's a lot of things over-the-counter you can take for acid reflux. And you can also adjust your diet as well. You avoid the spicy. Okay, you avoid things that trigger you. For some people, tea and coffee will trigger acid reflux for them. Eating, spicy food. Don't go to bed within 2 hours of your last meal, because you want to sit up and give your food a little chance to digest. And if you are taking over-the-counter medication, there's Zantac and
Right,
Prilosec and all of these things out there. Sometimes people will come in and say they're having such terrible reflux. The medications are not working for them as well. Again, you go back to your provider. Maybe there's something stronger they can prescribe for you, or you need to do an endoscopy where they go in and take a look and see if you have gastritis or something like that.
That's true.
Everything you have, every complaint you have, and you're concerned about it, you go to your provider and they have to help you get to the bottom of it.
And when she says the provider, you have to. She's talking about your doctor.
Yes. Well, it could be a nurse practitioner too.
Yes.
There are nurse practitioners who have their own practice as well. You can practice
absolutely.
after a certain time period.
That's true. I see Sheila Mangar. She joined us from Suriname. That's good. Welcome, Sheila. I'm so glad you're watching the program. One of our regular listeners, John Namat, he's in Suriname too. Angela says, my mom had an open heart surgery in 1999 and she died in 2017. Wow. The doctor said that it was a miracle that she lived so long. She died at age 86 years old. And so we're sorry to hear that she died, but and I know that you always say sometimes how difficult it is for you to go to continue living your life with your mother. But something, you say you like curry, so you probably have to stop eating all this curry, Angela. I know Angela is very funny.
I thought you was telling that to me.
No, no. Angela Ramson, she always like to be funny, so I'm telling her mother died. So now she got a young age. Now she can stop eating all these things.
Let's not criminalize curry, okay? I can't do that. I can't do that.
Well, John, I'm so glad you said yes very late. So much to do today. But I know you're always supporting us. So thank you very much. I see my good friend from Trinidad and Tobago, Delari Fernand. Thank you very much. I hope that you are feeling better in Trinidad. And I always like to have you locked on to our program. Let's see. It's now 6:45. We could talk about 5 things that we can really eat to help keep those tubes free, so that the blood can go through the body freely. When plaque builds up and blood flow becomes inhibited, these clogs or blocked arteries can lead to most serious problems such as a heart attack, stroke, and other cardiovascular diseases. So what can we do to keep our artery healthy and free from blockage? Food, let's say some food that you can use naturally, remedy to regress the blockage and prevent further damage to your arteries. And I have to tell you guys, this is good things to eat, but it's not going to do it overnight. Let's say that you're going to eat this thing today. Definitely it's not going to happen tomorrow. So asparagus, I did not realize that asparagus is one of the best food to cleanse your arteries, full of fibers and minerals. It helps to lower your blood pressure and keep your blood from clotting, and that can lead to serious illness. It also helps prevent any hardening of the artery. Another good thing that we like, and I like, but I'm allergic to it, is avocado. Avocado helps reduce the bad cholesterol and increase the good cholesterol that help to clear the arteries, which is also known. It is good to help reduce your blood pressure. And I've always heard this, and there was controversy years ago that I was hearing it's not good to eat avocado, but I'm learning it's very good.
It's considered as having healthy fats. Animal fats are more terrible for you than plant-based fats, and avocado is considered healthy fats. Yes, it has fats, but it's healthy fats.
It's good fats.
If you're going to make changes in your diet, I mean, I know you're going through a list there, but you avoid, processed foods.
Right.
Prepackaged foods that you just have to stick on heat, canned stuff, white bread. If you love bread, and some people love bread, but go for a whole wheat or high fiber alternative, instead of just plain white. I mean, make the healthier choice more your everyday choice. And if you have to have something in between that you feel like eating, I would say don't deny yourself, but you have it once in a while.
Exactly.
Like that white roti you was just talking about.
Exactly.
And that dal puri and basap shut or clap roti.
Yes. Also, broccoli can prevent artery clogging because it's loaded with vitamin K, which prevents calcium from damaging the artery. it's full of fiber, which lower your blood pressure and reduces stress, can lead to tearing and plaque built up on the artery walls. So, and I always like broccoli. So we learned that broccoli is really good to eat. So, these fruits are really, really important for us to eat. Also, Indra, we talk about fatty fish, and some of them are mackerel. We've talked about this before. Sardine, salmon, herring, tuna are rich in healthy fats. And before you go, rather than you go for beef and pork and so on, you go for the fishes, right? As you know, omega-3 fat helps to increase good cholesterol and reduce the bad cholesterol, right? Which decrease blood vessel inflammation and formation of blood clots in the arteries and can lead to low blood pressure. So all these things are very good to eat because it's good for your heart, and it's also good for it helps reduces your blood pressure. So try to add all these things to your meal at least 2-3 times a week. Also, we hear so much nuts, and I know that the nuts is good to eat instead of reaching out in a cookie jar for all these butter cookies and all these nice cookies. We can try alternative stuff like nuts. Almond nuts are the best choice because they are high in monounsaturated fat, vitamin E, fiber, and protein, right? So the best thing is that we can get some walnuts rather than going for the regular nuts. I mean, it's more expensive, but at the same time, it's good for you.
And I know there's a lot of flavors out there, so you don't want to go and get the caramelized peanuts and the coated chocolate.
Oh yeah.
I
With
mean,
the
if you
sugar
could
and honey.
eat it, if you can have it in that natural form. Some people like the salt on it. Okay, you gotta watch that. They have a lot of low sodium alternatives.
Yes.
Food is becoming much more. How should I say? I don't know what the words, but it's altered to suit the needs of the consumer today. So now you
what they
have
like.
yes,
Yes.
to avoid that carb. Everybody is very conscious about the carbs and all of that. So now you have pizza made with cauliflower crust and all of these things. Once in a while you feel like you want to have that.
And then the other thing is, what's sad though in what I see is that the food that's good for you is so much more expensive that you can't really to go buy it. If I go to
the organic
place,
stuff.
tell me,
Yes, it's expensive, and not everyone has access to that kind of food. Not everyone can afford it, which is terrible because there's the push for eating better, eating healthier, organic,
Yes.
but not everyone can afford it.
Exactly. So, and what I noticed too, if you go to the store and you pick up even a small container of salad, it's like $6-7, could be $10. It all depends on what you put inside of that salad bowls. Okay, so don't forget, go for your almond nuts, and you know more about olive oil. It's one of the best oil, right?
Better oil,
Olive oil is rich in monounsaturated fat. Is one of the healthiest oil to use in cooking or in dressing. And I like to, what I do sometimes, I get my friend, I buy the oil, and she add different ingredients to it to make it so nice that you just don't taste the olive oil alone inside. So try that. You could make your own a salad dressing with olive oil, which is a good thing. Also, watermelon is favorite. It's a great natural source of amino acid. It also boosts your nitric acid production in the body, which help to reduce inflammation and can help in lower blood pressure. And as we're talking about watermelon, from what I know too, things like cucumber and so on, and all the melon family, it helps. It makes you pee a little bit, increase your urination.
It has a higher water content in there too.
It helps to regulate your blood pressure. So that's a good thing. We're gonna get our DJ to play another song, and then we'll come back and try to wrap up things here this evening. And time is running, especially when you're enjoying a good conversation.
Yes.
Right?
जुल्फों से बांध लिए बादल, सीने पे से उड़ने लगा आज छम 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 मैं नाचूं आज छम 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 मैं नाचूं आज बारिशों की ताल पे ये खनक मेरे धड़कनों की कह रही है झील तू जरा बार बार साथ मेरे सारे अब थिरकने लगे डोले जमीन नाचे आसमां मैं तो हवा हूँ हाथ न आऊं मर्जी से अपनी उड़ती ही जाऊं खुद की करूं मैं क्या तारीफें रात ने चुराया मेरा काजल मुझसे नैना मिला के मौसम होने लगे पागल सबसे होके बेफिक्र नाचूं मैं आज छम 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 छम
Raindrop bouncing, my heart is announcing you got to take me away. Let's start jumping, my heart goes pumping. I love you in every way. धड़कनों पे बूंद जो गिरी
तो नाचो आज छम 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 मैं नाचो आज छम 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 छम
Chum 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 chum.
Welcome back, guys, to another edition of the Mind-Body Connection. And as we said, this is a special episode. Today we are talking about coronary artery disease. I also would like to say hello to Miss Liz Spudderman. She is locked in, always watching our program. I say thank you very much. Also, guys, I wanted to remind you, tomorrow is our regular program from 8 to 10 p.m. on the Mind-Body Connection. We want you guys to call us in to call tomorrow. It's about you guys. Let us know what you want to say, and we'll be talking a lot about suicide prevention, especially we have the vigil plan around the world, like Guyana, Trinidad, and so on. So we'll be talking about that a lot. You can write in to us and let us know your question. We'll be televising our the vigil across the world. So please don't forget to log into us, okay? So I'm glad that you guys locked in. I see Facebook wanted to knock us off, but we thank God we closed that song off, and we could continue to our regular. So don't forget, please join us tomorrow on our program, on our regular program tomorrow, okay? So now we were going to say what you want to say.
Well, I saw that John Nyamat had one question there about Isodil and Inderal. So Isodil is a calcium channel blocker. Inderal, also known as propranolol, is a beta blocker. And if you have a weak heart, you really should ideally discuss that medication in particular with your doctor, because one of the main effects of this type of medication is lowering your heart rate. And if you have a weak heart to begin with, that may not be the best medication for you. So you should discuss that with your provider if you're taking that and you have a weak heart. And maybe the next time I come on, we can talk about a weak heart, and which is also known as heart failure.
Okay.
People use words, but it could mean many different things for us. And I also, before we leave, I want to say thank you to all the people who tuned in. At least I see old co-workers from North General. I see my co-workers from the hospital I currently work at, Mount Sinai Hospital. I see my family and friends from Trinidad and here as well in New York. Thank you so much.
I want to say thank you guys for tuning in tonight. Also, we want to talk about What else left for us to talk about? Make sure you eat a balanced diet that is rich in some good omega-3 food. I see somebody says, is there anything they could use for low blood pressure?
Keep yourself a little more hydrated. There's no medication. There is medication, but it's not the first line of treatment. It depends. How low that blood pressure is. Is it so symptomatic that you can't perform your normal activities of daily living? But in general, to avoid yourself becoming dizzy and so on because of your low pressure, you keep yourself hydrated. Maybe you are one of the few people we'll tell drink that cup of coffee in the morning.
Yes,
You
yes,
understand?
yes.
And if you feel like you're having dizziness, you want to pass out because of your low blood pressure, then you sit gently, calmly down. You change positions gradually because you want to avoid falls.
Right,
You know.
exactly. So, and we know that when people fall, it's a lot of problems.
Yes.
You could fracture your skull or whatever it is. And as you said correctly, when you're going to fall, if you feel dizzy, one of the best thing you can do for yourself, justice you can do for yourself, is try to take a seat
Yes.
and sit down somewhere before you fall and hit your head, and then there was so much problems. I see Umawati, she says, hello, I just see the program. Is there, and oh yeah, that was her question about blood pressure. I see one of my childhood school days friend, Kamo Harichan, she is from Lenora. Thank you for tuning in. I'm so glad all of you decided to tune in tonight, and I'm hoping that you guys are going to continue watching this program. Neela Powar said, thank you very much, Dr. Indra. And so I want you guys to go in the shout box and tell her thank you very much, and please let us have her back again. It was a great discussion between me and her, and I knew it was going to be a good discussion between me and her because we have known each other so long, and nothing wrong with having a great discussion. So on behalf of the Caribbean Voice, Indra, I would like to say thank you very much for coming onto this program today and to share some of your knowledge, your wealth of knowledge that I say. I also would like to say thank you very much for Joey, your husband, for coming and bringing you here in studio so that we could have this beautiful conversation.
Thank you so much.
So feel free to come anytime you want to come next week. We can strike things up. You don't have to worry. All you have to do is rub his head a little bit and tell him to bring you
I
back.
don't even have to do that. He's with me all the time.
I know, yes. So, and again, guys, please continue to watch our program, the Mind Body Connection, on every Monday on Island Zone Radio from 8 p.m. to 10 p.m. And, on Sundays, I'm going to try to have some special edition of the Mind Body Connection. I can't have something every week because I don't know my schedule, how it's going to work out. But I'm going to try to bring something that will be of interest to our community. Once again, thanks to all of you for watching, and to our DJs, Arvin, Nides, thank you for always helping out in this here, because sometimes it could be rough, right?
Yeah, you need a little music break every now and then. Yes.
That's right. So anything else you want to say? And to all your colleagues, I want to say thank you very much for supporting her and for tuning in tonight on this program.
Yes.
It makes a difference.
Yes, it sure does. Because you can have colleagues and then you can have colleagues, but you know what I mean.
Exactly so, yes. And all the very best, guys. Have a very pleasant evening until next time.
Take care.
We end.
All right. Well, that was pretty good.
Yeah, thank you.
That's no problem.
Thank you. It was a
Yeah.
good conversation.
Yeah, because I knew what I was talking about.
Yeah, that's
but
right.
if you
That's why I
bring
know-
me into